I'm a physician with Samaritan Healthcare Hospice. In my clinical practice, I see patients for hospice care, but also for palliative medicine. My grandmother was on hospice care when I was 5 years old, and that stuck with me for my entire life and made an impact on how I wanted to give back in my profession.
I work as a palliative nurse liaison in the hospital settings. 25 years ago, my grandmother was taken care of by Samaritan, so when I was ready to come back to work, it was the only place I wanted to come. People who are on hospice have made peace with what's going on, emotionally, spiritually, and we're making them feel physically comfortable. But with palliative medicine, we see people before that stage.
Palliative medicine is a medical specialty. The focus is to support their symptoms while they have ongoing medical treatments. We also discuss goals of care for that patient. We discuss advanced care planning, such as an advance directive and a PULSed form, and work with the patient's other medical providers to provide the best care that is oriented to that particular patient's goals. It may be a time where that patient might have a terminal condition and families have not been communicating with the patient or vice versa about their end-of-life wishes. It also may be a time where our specialty providers can look at symptom management to help shorten a hospital stay and to make plans for post-hospital care and to be part of that patient's medical care after they're discharged from the hospital. Our palliative team was asked to see a patient in an emergency room setting. We found an elderly patient who had respiratory failure. She was unable to breathe on her own. She was on maximum support with a mask, blowing forceful air to allow her to breathe. She was not able to respond, and she had no family with her. The team had been communicating with the patient's son, who was on the West Coast and unable to be part of that patient's care at that moment. The goal of that son was to get the husband there so that the patient wouldn't die alone. He was unable to do that. Her documented wishes stated no curative measures, no level of life support, no level of artificial interventions, which is what we were currently providing. We had to come up with a plan to allow that patient to pass away peacefully and comfortably, but also to make sure she wasn't alone.
I got my personal phone and we put it on speaker. We held the phone to her ear and he said all the things you would think a son would say, that he loved her, she was a wonderful mom. And he continued to say he would take care of the father and that everything was going to be okay and that he only wanted her to be at peace. The emotion just came over us knowing that this son was not going to see her. We removed the mask, and at that point she squeezed Dr. Pagliaro's hand very hard. I think she was aware of what was going on. She heard her son. She knew we were there. We both left that day feeling very happy that we were able to give her this at the end of life.
What we were able to do was take that stress off of that patient's son, to summarize what was happening, to give him a set of guidelines and goals, to review the patient's documented wishes, which were clear that she would not want her life prolonged under any means. And part of my job was to let him know that extending her life to wait for him to arrive may not be in her best interest. There are days where you feel that you didn't do enough, or maybe you weren't able to help those families or that patient as best as you would have hoped for various reasons. This case was one of those cases that made me feel that I am doing the right thing, that I'm in the right profession, that I was in the right place at the right time, that it happened to be while we were working together and were able to bring that special care to that patient that would probably not have been provided for her, and make that son feel that he can be at peace with his mother's passing even if he couldn't be there at her side. We're not just providing medical care for the patients. It really is a larger spectrum of care for the medical needs for the patient, but the spiritual and emotional needs for that patient and their loved ones.
I see the difference that we make. We really do go in there and give them a little bit of brightness, and knowing that I've helped only one person even at that point gives me a lot of satisfaction.